true success is not in the learning, but in its application to the benefit of mankind. For Thailand, much alertness and importance have been given to the preparedness for, prevention of, and response to emerging infectious diseases, EIDs. Between 2005 and 2016, 3 national strategic plans were drawn up and implemented. Currently, the 4th plan, that is, National Strategic Plan for Emerging Infectious Diseases, 2017 to 2021, is being implemented, emphasizing systematic, efficient, and timely actions through multi-sectoral coordination regarding knowledge management and integration of efforts based on previous experiences and lessons learned. Emerging Infectious Disease Preparedness in Thailand, linking community-based approach and research for the national system. Strategy 2. Surveillance, prevention, treatment and control system development for emerging infectious diseases using the One Health approach. Here is Wat Luang Phomawat, a Buddhist temple in Panatnikom district, Chonburi province. It has been one of Thailand's habitats of about 10,000 fruit bats for about 100 years. What we are seeing now is the integrated action of several relevant agencies under the One Health approach in collecting specimens or samples from fruit bats or Lily's flying foxes. This is a surveillance effort on pathogens or infectious agents of zoonotic emerging infectious diseases that can be transmitted from animals to humans, coordinated by the Thai Red Cross Emerging Infectious Disease Health Science Center, TRC-EID, of the Faculty of Medicine, Chulalongkorn University, and King Chulalongkorn Memorial Hospital of the Thai Red Cross Society. Dr. Supaporn Wachara Phuksadi, TRC-EID, said, based on past experiences of our neighboring countries, there was an outbreak of Nipah virus encephalitis transmitted from fruit bats to humans, resulting in the losses of lives and the economy. That was the beginning of interest and research of the existence of infectious viruses in fruit bats, leading to the present-day surveillance program in collaboration with the Department of Disease Control, as well as many other relevant ministries and organizations. Under the National Strategic Plan for Emerging Infectious Diseases 2017 to 2021, one of the important strategies is surveillance, prevention, treatment, and control system development for emerging infectious diseases using the One Health approach. Today is another day for a team from the Faculty of Forestry at Kasetsart University and another team from the Department of National Parks, Wildlife and Plant Conservation under the Ministry of Natural Resources and Environment to work together. Their work began in the morning with the collection of fecal, urine and blood samples or specimens from fruit bats, followed by physical examination of such samples. Other related samples are also collected for use in developing a database in various aspects and for laboratory examinations. Assistant Professor Dr. Prateep Duangkar, Lecturer, Faculty of Forestry, Kasetsart University said, "We have conducted studies on wild animals in various aspects related to forest. After the outbreaks of emerging infectious diseases and the One Health approach, we are studying the ecology and biology of fruit bats, identifying how they are associated with the identification of infectious viruses in different species of fruit bats. This knowledge will be useful in the surveillance and prevention of animal-to-human viral transmission. Supakarn Gao Chod, veterinarian, professional level, Department of National Parks, Wildlife and Plant Conservation said, "The relationship between human and wild animals have become closer than before, so more surveillance efforts have to be undertaken regarding animal and human health. Our agency cannot work alone. Rather, we need to share or exchange knowledge and apply such knowledge. That is because we have to take care of animal health, especially when dealing with ecotourism, as well as the surveillance and prevention of diseases transmitted between wildlife and humans for tourists and national park officials. The results will be verified again in the laboratory." Laboratory at the Thai Red Cross Emerging Infectious Disease Health Science Center of the Faculty of Medicine, Chulalongkorn University, and King Chulalongkorn Memorial Hospital of the Thai Red Cross Society. This lab was one of the labs that performed the confirmatory viral diagnostic test for the first MERS patients in Thailand, which led to the prompt outbreak control action in the country. At present, the lab also performs several other related activities, including zoonotic viral surveillance and the examination of specimens from fruit bats. The specimens from local areas will be examined, and the results will be analyzed and used for research and surveillance on other infectious agents that might cause other emerging infectious diseases in the future. Dr. Supaporn said, "We have detected Nipah virus in fruit bats in Thailand, but there has been no animal-human or animal-animal transmission of the virus in the locality. In cooperation with the Department of Livestock Development, we regularly perform physical examinations of animals in this area. Blood tests have also been undertaken for local residents in the community. None have been found infected with the virus. Anyway, we are not negligent. We will keep cooperating with the community in the surveillance effort." Enhancing the knowledge of EIDs in the community is an important surveillance mechanism. In Thailand, a Tambon Sub-District Health Promoting Hospital, THPH, is the frontline healthcare facility that is close to people in the community, providing basic medical care and promoting health awareness in various aspects through village health volunteers, VHVs, as the driving force. Today, a meeting for village health volunteers is being held. It is a good opportunity for the research team from the RTC EID to review or reiterate the knowledge and steps of bat-related viral surveillance as previously undertaken in the past. The team has trained the village health volunteers to help with community health education as well as disease surveillance in the field. The volunteers also help collect field data and create understanding among local community members to be aware of the danger of animal-borne or zoonotic diseases. Thanapon Puttaraksa, President, VHV's Club of Wat Luang Sub-District, said, "We have been living together with fruit bats. No one is sick. We have seen the work of the research team from Chulalongkorn University since the beginning. Originally, we did not know that the bats were reservoirs of germs or infectious agents. Having learned from the team, villagers have been aware of disease surveillance and prevention. We are proud that we have known about the disease. At least we know that we will not eat any fruit that has been partially eaten by the bats. And we know how to clean our bodies after contacting bats' urine. We are not supposed to catch any bats and cook it as food. And we know how to care for the ecosystem." สนใจพรพัฒนานิคม Director วัดหลวงตำบล Health Promoting Hospital, said, "Villagers are now aware of how to protect themselves. Not panicky, they do not harm any bats in the locality. The Chulalongkorn team has trained our village health volunteers to help with case detection and disease surveillance in their designated areas. They are supposed to notify the health promoting hospital if there is any unusual illness or situation in the community, and any suspected case will be transferred to the district hospital." Here is Panat Nikom Hospital in Chonburi Province. The hospital has set a good example of an important measure for getting the local community prepared to respond to any outbreak of an emerging infectious disease, according to the guidelines of the Ministry of Public Health. Today, there is a preparedness drill to cope with an emergency in case there is a patient with emerging infectious disease. This hospital will serve as the next level of healthcare for disease control, and it has designated a screening area at a separate place, away from other service recipients. Assigned personnel are prepared to prevent from contracting the virus and review the plan for coordination with other relevant units in the hospital, transfer of patients, and management of relevant personnel, including doctors and nurses. The patient will be isolated in the specified area. The doctor and nurse will come in to perform a physical examination on the patient and collect lab specimens. And other surveillance activities will be undertaken according to the disease control guidelines of the Department of Disease Control. Dr. Sakchai Kanchana Watana, Secretary General, National Health Security Office, said, "Regarding the prevention and control of emerging infectious diseases, the National Health Security Office provides some funding support and policy guidance from its emergency fund, which has earmarked about 200 to 300 million baht for use in case an epidemic occurs. That is to support the healthcare system on a timely basis. At the micro or local level, we have got the Sub-District Health Fund that can allocate funding support in case of disease outbreak at the level." As for multi-sectoral coordination in the implementation of the National Strategic Plan, the management of the operational cooperation for program monitoring and evaluation is an important issue that every sector involved pays attention to. Today's event is another forum for knowledge sharing among all concerned. Dr. Waraya Leung-on, Director, Bureau of Emerging Infectious Diseases, said, "The key to success in responding to an emerging infectious disease is to ensure that the preparedness is maintained continuously by all concerned, not only by the health sector. That is because disease outbreaks affect many sectors. Similar to a fire management system, good preparations and drills are required. All concerned have to know what each one has to do. When an incident occurs, if it cannot be stopped, the impacts have to be mitigated as much as possible." This is one example of the initiation of efforts for defining a clear role of each relevant agency, setting policy, and developing a management and coordination system so that the public, private, and civil society sectors are involved to ensure the effectiveness of Thailand's measures for preventing emerging infectious diseases.